want significant freedoms, you need 70% of your population fully vaccinated. Everybody who is double vaccinated at 70% will be able to go to a cafe to have a meal, will be able to do all those things.
You've got to get to 70%, you have some more options. 80%, then we're into a different world.
In 3 or 4 weeks from now, 70% of people aged over 16 in New South Wales should be fully immunised. While a major relaxation of restrictions isn't in the national plan, New South Wales is proposing to reopen hospitality venues, retail and gyms for vaccinated people with some conditions. Gatherings of 5 people will be allowed in homes, and major outdoor events of up to 5,000 people will be permitted.
I think opening up at 70% is very risky given the current rate of infections that we're seeing in Sydney and New South Wales more generally in some pockets. But inherently this is going to be incredibly difficult to police, and you would have to expect that the lifting of restrictions for vaccinated individuals will also lead to some a lowering of compliance amongst those who are unvaccinated.
When New South Wales reaches its milestone next month, it will leave 44% of the population either partially vaccinated or totally unprotected. In addition, there are still likely to be high case numbers and therefore a lot of virus circulating. And since the vaccines only reduce the risk of infection by half at best, vaccinated people can still catch COVID from others and then spread it.
We would still expect significant transmission within those indoor venues. And of course, when those people leave those venues, they go back to the community, they go back to households in which other people may be unvaccinated, particularly children at the moment in terms of eligibility. And then we start to see those pressures on the hospital system.
Burnet Institute epidemiologist Professor Mark Stuve would prefer to see a more gradual opening until we reach higher levels of vaccination, perhaps as high as 90%. One country that opened up with a lower immunisation rate is Denmark. In April, the Danes began opening up to the 10% of the total population that was fully vaccinated. Last weekend, Denmark removed the last of its restrictions when 74% of the population was vaccinated.
We are a small country, we are above 5 million people. We were very careful gradually opening things and looking into what were the effects of this.
Copenhagen-based virologist Professor Alan Randrup Thompson is an advisor to the Danish government.
Our vaccine coverage is extremely good, and that of course is a key to why we dare lift the restrictions right now. We would have liked the restriction to have been extended just a little longer, just to see how much is the effect of, everybody being back from summer holidays and opening of schools, etc. The feeling in the population was that we might have lost the backup from the population if we had just blindly continued to have restrictions.
The numbers Denmark is focusing on now are hospitalizations, ICU admissions and deaths.
2/3 of those that are admitted to hospital right now are younger people that had never been vaccinated. So our main focus right now is to, even though we have a high coverage, to get the rest of these younger people vaccinated. I'm pretty confident that we have the epidemic under control. But of course, there is a number of unknowns. You never know with coronavirus because there may come a new variant that could change the whole thing.
Places like Denmark are really setting an example and providing us with a lot of data and information about what the implications are of a combination prevention approach that includes high levels of vaccination, but also judicious use of certain restrictions in high-risk environments.
While Australia is looking at New South Wales, Victoria has some critical decisions to make as its population endures its 6th lockdown.
The Victorian government is planning on releasing their own roadmap later this week, based on previous experience. It's likely to be relatively cautious and perhaps more cautious than New South Wales. Victoria is behind New South Wales in terms of its vaccination rates. So they will be able to learn from what happens in New South Wales.
Another hallmark of Denmark's approach has been the relatively high level of public trust in the country's leaders over the course of the pandemic.
The confidence of the majority of Danes to the handling of the epidemic is very high. Of course, you will always find a few that are in opposition, but overall, there's a good deal of trust between the Danes and the health authorities.
Professor Mark Stuve believes that our leaders need to be transparent about the implications of opening up and what living with COVID really means.
When politicians talk about freedom days or freedoms and living with the virus, I think politicians also need to qualify those statements with what living with the virus actually means, so that the community can understand what the trade-off is.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.